Greetings, everyone. My name is Dr. Farzana Chohan, and we are having a conversation today about what is the purpose in life, and no matter in which industry we are working, how we get on a path which is helpful to our fellow human beings. In my quest to be human for humans, which is informed by my own lived experiences and life on two different continents, I continue to look for fellow human beings who are on the same path and same journey, because as much as we can know about each other, it helps us in becoming better in this world, regardless of our origins. With that purpose in mind, my today's guest is very unique in her work and where she started and where she is and how she is serving others. And it is my honor to introduce Dr. Gerda Maissel, who started as a medical doctor, and right now she is known as a medical Sherpa. She guides people and specifically her patients through all the ups and downs of a complex health journey.
I really appreciate the invitation to be here today. It's my pleasure. I'm a physician by background, and then I spent about a dozen years in C-suite type of positions within health systems. So chief medical officer, chief transformation officer, medical group president for hospitals and medical groups in moderate-sized health system. And about 2 years ago, during the pandemic, I decided to leave the world of corporate medicine behind and started this business, My MD Advisor.
Please tell us, what does My Advisor mean?
What I do is I try to relieve the suffering of families and individuals with complex medical problems. In my other roles, I often reviewed quality complaints or even lawsuits that might happen for some of my doctors. And I saw how often families just got so overwhelmed and frustrated. Communication broke down, trust broke down. And so with the business, what I wanted to do was to help people really understand their medical choices and help them understand why the health system sometimes acted in ways which made no sense.
In the industries and professions we work in, and especially in healthcare, there are a lot of complex dynamics involved. And to me, it sounds like that you came to this point because of lived experiences. Would you like to tell us that how that empathy has been ingrained and embedded in your being and what you do now?
Some of my early influences that caused me to want to become a physician. And it goes back to before I was born in the late 50s, when my mother, who is an immigrant, caught German measles while she was pregnant. While my mother was pregnant, my older brother was affected, and when he was born, he had congenital rubella syndrome. Now, back in the 50s, early 60s, they didn't have a name for that. They blamed my mother, which was a common issue. My older brother couldn't see properly, was very impaired, couldn't hear, and of course had cognitive deficits. He was at home with me, and I remember him well as a young child. But then my younger brother came along, and my younger brother's 6 years younger than me. And my mother was very overwhelmed, and she made the heartbreaking decision that she couldn't take care of a new baby, an active, curious, 6-year-old at that point. And she made the decision to have my older brother institutionalized. Back in the 60s, you could place a child with the kind of disabilities that my older brother has in a facility. Unfortunately, the facilities in the 60s the conditions were absolutely awful. I still associate the smell of sewage with the visits that we used to have to my older brother, Simon. And part of what I remember was the impact on my mother, and my tough, strong, mother would sometimes cry. She would sometimes get very frustrated when the doctors wouldn't listen to her. She tried very, very hard to be an advocate for my older brother. She didn't stop loving him even though he wasn't living with us.
This must be heartbreaking for your mother. She sounds like a strong woman who still kept the family unit together.
She is. And my mother is almost 92, and I give her so much credit for what she did, because my father would not go to see my older brother. His way of coping with it was to just pretend he didn't exist. And I think it was very, very hard for my mother.
So, what kind of characteristics your mother has demonstrated in that process, which you have embraced in yourself?
When Thorazine came in, which was a powerful tranquilizer, my mother would push back and would ask, well, why did he get it? And my mother would say, well, instead of giving him this medicine, can you try doing this or doing that? He's nonverbal, so when he's pulling on you, that usually means he's hungry or he needs the toilet. And so the importance of seeing every patient, every family as an individual and not just prescribing medicines. There were a lot of lessons at home around what good medical care could and should be like.
So her empathy and her grit were the driving forces, her empathy for her son and her grit to continue to advocate. Why do you think advocacy is important, both in terms of patients in healthcare system and then otherwise?
Well, I can speak best to the healthcare system. And I've been in the healthcare system for a long time. Mm-hmm. And what I can say is today, we know that turnover in healthcare is incredibly high, as is burnout. You need an advocate to not only help the family and the person with the medical condition know, here's when you need to push back, and to help them know, oh, here's what the doctor really meant. And the doctors often need an advocate. I find myself as a physician often slipping into doctor speak. You know, the family may only have 5 minutes with the doctor, and without counsel from a physician advocate, they may spend the 5 minutes talking about something not relevant to the medical decision making. So a medical advocate like myself helps both sides. It helps the doctors make better decisions or better recommendations, and it helps the families get the answers they're looking for.
Do you think we have lost what our focus should be in trying to develop and refine our professions?
I think that's a complicated answer. I think there are a lot of wonderful, wonderful people who are working as doctors and nurses and aides. So I don't want to say that the profession has lost its way or that professions have lost their way. I think the whole system right now is under strain, and that causes individuals to sometimes do the best they can to cope with their work environment as a doctor or as a nurse. And sometimes that means on the front line for the patient, they don't get the quality, attention, and thought process that they deserve.
You are right. It is the system which seems to act as a barrier in front of people with good intent who come into healthcare at all levels. And talking about American healthcare system, even in Canada, I have heard from friends that when they will go into doctor's office, there are notes posted that only discuss one problem in one visit. That baffles me. I am unable to understand that where we are going with all this. Are we really moving towards a futuristic healthcare, or are we just digressing back?
Healthcare is an industry in disruption. So I see us at a point in time in the evolution of American healthcare where there will be different solutions in the future. I think it's a very mixed thing right now. I think we're going to see some patient-centered changes, and I think hospitals and traditional healthcare is going to continue to struggle.
As our society, previous generations are aging, more and more of them are alone, lonely, by themselves, what can they do in terms of having a patient advocate for themselves, or how they can prepare for unfortunate scenarios?
So you're talking about a really important population, people that are aging on their own. And I've been watching the industry as it even tries to name this incredibly important demographic. The first term that I heard, and I don't like this one, elder orphan. I understand why someone might use it because it evokes some sympathy and a sense of a person being alone, but it feels pejorative to me. I tend to like the term solo ager. There's also, I think it was the Wall Street Journal or the Times, I don't remember which one, recently had an article on what they called kinless seniors, seniors without family, kin. I think there is more attention being paid to that demographic. When it comes to what the right thing to do is, I think there is a lot of help out there and it requires money, which is often the barrier.
I had a mentor and she was 75 years old. And over the years, I saw her suffering. Her foot was like this big, and she kept on to going to urgent cares and other places, asking them to diagnose her problem. And people just disregarded her because of her age. She was eventually diagnosed with stage 4 kidney center, and she passed away in less than 4 weeks. And none of the people who have seen her suffering in last many years thought that she is so seriously sick. Seeing her death in that way, where she could have been saved, is traumatizing. It's traumatizing.
Horrible. I'm so sorry.
But I mean, what can we do? It is about how we can be more human focused and human centered in our approaches, regardless of our backgrounds and professions. Any suggestions for people who are listening to you, how they can be more human centered and human focused?
Well, I have some advice on, for example, in your friend's case, she could have used a medical advocate like myself, who would, a medical advocate would have arranged for her to go someplace where she was taken seriously. And unfortunately, what you mentioned sort of in passing, that women, and especially older women, are often not taken seriously by the medical system. And it's a real tragedy, and it's unconscious bias, but it absolutely exists. Again, I think sometimes you have to get someone, we should all be good humans to each other. When it comes to engaging with the medical system, sometimes you need to find someone who can speak the language to advocate for you. And it shouldn't be that way. And I often feel like it's a tragedy that I'm needed, but sometimes simply the act of speaking the language makes a difference to how much the humanism of the doctors and other people that you're dealing with can come forward.
Absolutely. And thank you for mentioning that, talking about the unconscious bias and how we give priority to some people and not to other people. What is your message, both to the people who are coming into the field and to the people who think they will be or they are suffering from some kind of a disease which they need to take care of?
Well, to people who might want to be advocates, I say, come on, we need more of you. There's a board certification, and I think that it's really important to have more patient advocates. I think it's incredibly needed. I know that over the course of my career, where I've done many different things, this is the most satisfying work, this most meaningful work that I've ever done. And when it comes to people that are struggling with complex problems, I would encourage them to consider, depending on what's going on, a geriatric care manager or a patient advocate. These days with the internet, there are so many options to connect to resources or peers and find solutions.
A follow-up question is that if someone like to be a patient advocate or come into this field, what is the qualification they need and what is the characteristic they need?
Well, the characteristic is caring. As you said in the beginning, you have to find joy in making a difference for someone. The patient advocates usually divide a bit into people who are advocates and help with billing and insurance and medical problems, and advocates that are doctors or occasionally nurses that help with the medical navigation in the way that I do medical navigation. I would encourage them to look up BCPA, Board Certified Patient Advocacy. There's a group that helps people understand what they need to do to prep to take the board. And I think it's an important qualification to have because it shows that you have an understanding that's necessary to become a patient advocate.
Encouraging people to step in and do whatever good they can do in their own capacity is really important. Are there any last statement you would like to make before we close our conversation?
No, just to thank you for this lovely conversation, to invite anybody in your audience who has questions, or whether it's about advocacy or whatever they might have, a medical question. You can email me at gm@mymdadvisor.com, and I'm happy to check in with people and see how I can help.
I want to thank you, Dr. Gerda Maissel, for doing what you are doing and know what it means to help your fellow human beings. So you are a true example of Be Human for Humans.
And thank you for having me. I really enjoyed our conversation. Thank you.